Good evening. I'm Samuel R. Pasamonte, and this is the Management Information System for the Novaliches District Hospital. So for this presentation, I'll be discussing an introduction or a background to the Novaliches District Hospital. Then we'll be discussing what the state of its current information system is, what the problem is and how we are going to solve it, the conceptual design of our solution, the systems and users interface of said solution, and an implementation plan on the said solution. So let's start with an introduction. What exactly is the Novaliches District Hospital? So the Novaliches District Hospital is a government hospital established in 2001 by the Quezon City government to provide healthcare services to residents of the Novaliches area and surrounding communities. The hospital's objectives, which are aligned to its mission and vision, are accessibility, which means affordable healthcare to its patients that is readily accessible to those from the surrounding communities. Affordability, so it aims to provide affordable healthcare, keeping costs per patient low while ensuring a high level of service to each patient. Improved facilities. As part of the hospital's mission, it seeks to improve its facilities in order to serve its patients better. And finally, a patient-centered environment. This is done through an open decision process and information sharing between departments. So here is the mission and vision of the Novaliches District Hospital. The mission of the Novaliches District Hospital is to provide quality patient care through improved healthcare facilities and services that are relevant and effective to the needs and concerns of the community, to maintain a zealous dedication and professionalism among its staff, leading towards effective healthcare management, to provide its staff with continuing professional and staff development, and to establish a medical training program in all services of the hospital, and an open clinical decision process inclusive of information sharing and interdepartment cooperation, which creates a patient-centered environment. The vision of the Novaliches District Hospital is to be a tertiary hospital that provides quality health care that is readily accessible and affordable to the public. Note that the objectives of the Novaliches District Hospital are in line with its mission and its vision. So here is the organization structure of the hospital. It is currently headed by a hospital director who has 4 assistant directors for each of the different services. Clinical services involves the doctors and the medical staff of the hospital, which includes OB-GYN, surgery, and internal medicine. Ancillary services involves those that are responsible for diagnosis like laboratory, radiology, as well as other services like the pharmacy. Nursing services oversee the various wards as well as the emergency room of the hospital, and the administration takes care of items such as business, information technology, security, and all of the other administrative tasks of the hospital. We now identify certain constraints to planning when planning for the objectives of the hospital. Constraints to planning include the following blockers. The medical staff is not tech-savvy, so additional training costs are incurred. The information systems in this hospital are manual, so there might be issues converting the previous manual data of the hospital into something that is readable by the system. Another possible issue is patient confidentiality. because of the Data Privacy Act of 2012 and existing patient hospital confidentiality, any new system that involves patient records will need to require a high level of security, especially considering that this is medical data. Lack of facilities, so an additional budget for acquisition may be required, and political risk. Currently, the local government unit of Quezon City is favorable to the hospital, but the next local government unit might not be so favorable. Here is the state of the current information system. We also included SWOT analysis to see if the hospital could fulfill its objectives, especially when considering a management information system. So the current state of the hospital's information system is that it's manual. So forms are manual. If there are any record-keeping systems, they are limited, such as that of patient records. So only these 4 details shown here are kept for patient records. So current state of the hospital also is that not all departments or areas have computers and they are not connected. In particular, the emergency room is not computerized. A patient who is rushed to the emergency room or his companion will need to provide data through the written form to computerized units such as radiology and laboratory. So let's say a patient comes in, he needs to write down his details, and then those details will be passed by the patient himself to radiology or to laboratory. Also, there is no interconnectivity between units, and only one unit, the business unit, has access to the internet. That said, we now proceed to the SWOT analysis of the Novaliches District Hospital. So first, let's look at its strengths. The strength of this hospital is its people. Manpower is willing to improve and has commitment and loyalty, and this can-do attitude, adaptability, and willingness to do anything to help patients in need, despite the fact that because they're a government hospital, they're lacking in facilities. There is a high level of professionalism, and the skill level within the hospital is also high. Weaknesses, some of these were mentioned during our constraints to planning. The medical staff is not tech savvy. Most information systems are manual. Processes are inefficient. These lead to patient complaints. Patient confidentiality hinders any automation effort. So there needs to be a high level of security for any system before it can be implemented. Lack of additional facilities, which, if there are added facilities, they might actually be abused by staff in a process called cyberloafing. Cyberloafing is when a staff member wastes his time using the facilities of the hospital. For opportunities and threats, there is this double-edged sword called the budget. Now, the opportunity here is currently there are funds available because the local government unit led by the mayor of Quezon City is favorable to the hospital. But the threat here is political risk. So, the next administration of Quezon City might refuse to provide a budget. And that would be your threat. So now we're discussing the problem and its solution. This would be the project's identification and problem definition. So the problem is that the Novaliches District Hospital's emergency room process is manual. So what happens is patients fill out the form for medical records. The physician fills out another form for tests to be performed on the patient. Patient brings form to billing for payment. Only then can he go to the diagnostic unit, either radiology for x-rays or laboratory for other tests. Then patient needs to wait for results and then provide them to physician for treatment. So herein is a flow chart of what happens in the emergency room as of now. Okay, so the solution, and this is the identified project, is emergency room automation. The emergency room should be able to instantly send requests to radiology and laboratory departments. Attending physicians should also be able to access results of these tests easily. There will be an interface to the billing system so the patient can be billed when he is discharged instead of before the diagnostic test. Then the system must be easy to use even with minimal training. So here's the revised flow chart. Instead of 9 points, we only have 6 nodes for the patient to go through. Okay. So now we're into the conceptual design of the emergency room information system. So what is envisioned here is that the emergency room would have its own computer, which will access the web information system, which also is intended to interface between units. So laboratory would have an interface there, so would radiology, so would billing. Everyone would have an interface there. Now this web information system will only be through intranet to provide for patient confidentiality and to avoid the risk of patient data being leaked. So this is a flow chart of what happens in the conceptual design. So we have a home page where the encoder would log in, and then what he does is he would either enter the patient details or see that the patient is already in the system, whereby he will request a diagnostic test, which will go to the interface to the diagnostic unit's side of the web information system, where test results will be output. Now, this is for the minimum viable product. Eventually, we'll be adding an interface to the billing system and to other required information systems for the doctors to be able to see the results. So here is the systems and users interface for said emergency room information system. So we're intending to use the following technologies. Since this is a web information system, we'll be using MySQL for the patient database, Apache as a server, PHP as the server-side scripting language, and HTML, CSS, and Bootstrap for the front-end web design. Now, this system is intended to be installed on a Linux computer, which will act as a server, since that operating system can handle limited specifications. Also, it is very economical to use Linux since it is free and open source, not like Windows, which you have to pay huge licensing fees. So this is what the user interface is envisioned to be like. Since it's a web information system, what the first thing the encoder would do is log in, and then once he logs in, the rest of the windows will pop out. Now, these other windows have not yet been mocked up. They will be mocked up as part of the implementation plan. Here is an entity relationship diagram of the currently envisioned system. So we start with the patient, and these are the details that the patient has. And the patient would request a diagnostic request, which would go to a test unit. Now, this diagnostic request will instantly be sent to, say for example, radiology or to laboratory, as the case may be. Later on, this entity relationship diagram will grow as other interfaces are also added into the system. here is the implementation plan for the emergency room information system. So we have a schedule for implementation which assumes that we start immediately since we are already gathering requirements, doing the analysis, the systems design, etc., etc. So implementation, we could start implementation by May 21 and end on July the 25th. This assumes, of course, that the budget is already in place and that all the support that is required is provided. Now, here is a more detailed Gantt chart of said schedule which specifies every detailed steps in this from analysis all the way up to implementation. You will notice that implementation is in sprints. This is because the methodology that we'll be using here is a disciplined agile approach. And with that, thank you for listening. Have a great day. So now we go to the implementation plan of the emergency room information system. So how will we implement this system? Well, we have a schedule for implementation, and this is the tabular version. This is a shortened version for everyone's appreciation. So we started with preliminary investigation. Then we are in the systems design and analysis stage. We were targeting May 12, but we completed it in May 10, so this is very ahead of schedule. Now we go to implementation. So we can start implementation as early as May 21, assuming that we have the budget and that all the requirements are met. And if we start on May 21, we can have a finalized system by July the 25th. Here's a Gantt chart showing the detailed steps of what needs to be done. So we've done all of this, meeting with stakeholders, feature grooming, finalization, systems design, and now we're at implementation. So our implementation is in sprints because we are taking a disciplined agile approach to this program. So we have the first sprint, which is to just set up the minimum viable product. And then we just add features until we get something that the hospital would really appreciate. Up until July the 25th, which is in the week of July 30 over here. And with that, thank you so much for listening. Have a good day.